Thanks so much, Josh, and thank you all for being here today. We're going to have a fantastic panel right now to discuss the intersection between public health and the climate crisis. My name is Jessie Bluedorn, and I'm an organizer with Sunrise Movement NYC and the Earth Week NYC campaign, which, quick plug, you can learn more about at earthweeknyc.com. We don't have a ton of time together today, so I'm going to dive right into the questions we have heard. We know that the climate crisis will lead to an increased emergence of new diseases like COVID-19, which will impact certain communities more than others. Based on your work, what is one thing that you want to tell viewers about how we can address and combat this inequality? So I'm going to kick it off with you, Dr. Lee, if you want to start.
Hi, can you hear me? I'm unmuted now.
Yes.
So my lab studies actually viral emergence, and the one message I want people to take away is that the world is interconnected. This coronavirus we did get from bats, but we have to be careful about doing the right kind of surveillance. Not just in China, the global diversity of coronaviruses is really great. There's a whole bunch of them in South America. There have been studies done in 2017 that you can actually predict on the map that the level of coronavirus diversity actually can coincide with the degree of epizoonotic or zoonotic transmissions. And one of the hotspots actually is and around the areas of Wuhan. I just also want to clarify that in this time of social media, this is arguably the first pandemic of the social media era, that we have to find trusted sources. And we have to do our best, those of us who are scientists, those of us who are public communicators, to actually get the truth out. We all have our different viewpoints, but eventually there is facts and there's opinions, and those of us who are scientists actually have to make it clear when are facts and when is opinions. And it's okay to say that we don't know, because this is a 4-month-old epidemic and there are certainly some things that we don't know. And last point I want to mention is, with all due respect to Ali Khan, is pangolins have not been definitively identified as the source. They found a virus related to SARS coronavirus to a pangolin, but there's about a 25-year mutational gap there. And so regardless, it is from some animal reservoir, and bats do very important things for the ecosystem. Unfortunately, they also do carry a great amount of viruses, and what we need to do, learn from this experience, is to how to do the proper surveillance and invest in not just public infrastructure, but in the right kind of surveillance, so that we can help this. The next one is
Thanks so much. Let's go ahead and go to Dr. Gounder next.
Hi, everyone. I think the main takeaway for me, witnessing yet another pandemic in my lifetime, as somebody who has worked in HIV and tuberculosis really for the earlier part of my career, these are diseases not unlike climate change, which affect everybody, but don't affect everybody equally. And I think it's really important to remember, why is it that these infectious diseases, and for that matter, the fallout of climate change, will affect certain vulnerable populations more? So here in New York City, among the many hats I wear, I see patients at Bellevue Hospital. I can tell you the vast majority of patients who I've seen who've had COVID-19 at Bellevue have been undocumented, Spanish-speaking only. If you look at the New York City-wide numbers, Latinx and African-American communities have been the hardest hit. And in terms of the boroughs, it's the Bronx, Queens, and now Staten Island. And if you look at who lives in those areas, these are people performing essential services, who are in service jobs where they have to interface with people. These are folks who are taking public transportation, who have not been able to socially distance and telework. And so, I think we really need to think about who it's affecting, why it's affecting, and what we can do to mitigate that, especially as now we're talking about reopening the economy. And honestly, those of us, and I can't telework all the time because I do see patients, but in the rest of my work, I have that luxury. So for those of us who have that luxury, and are benefiting from the work of people on the front lines. That's how we make our living, is really from having those kinds of people working for us in various different capacities. You know, to be really cognizant of that and to really be giving another thought to how do we insulate ourselves, not ourselves personally, but ourselves as a society, against the damage that, whether it's climate change or an infectious disease, can really cause to all of us, especially to those the least among us.
Much, Dr. Gounder. And now to you, Briana Christophers. We'd love to hear your main takeaway.
Great. Thanks for having me. So to follow up on what Dr. Gounder just said, we know that there have been wide disparities when it comes to number of cases and the burden of deaths from COVID-19. So my call to action, so to say, would be that we need more sustainable investment into low income and predominantly minority communities, because it's not just an act of health justice or social justice, it also contributes to climate justice. And the way it does is researchers have posited that the reason that people of color disproportionately are at higher risk for pre-existing conditions like diabetes, heart disease, hypertension, even asthma, is due to how cities are built, right? So just to harken back to a week ago, right, the Surgeon General was giving a speech to the entire country, and he brought out his asthma inhaler from his pocket. And he himself said, I carry this around just as many Black and brown people do, because I worry there will come a day that I won't be able to breathe. Now, imagine that combined with getting sick with COVID-19. When it comes to how cities are built, there is a term known as environmental racism. So this is the thought that urban development can occur with disregard or malice toward a group of people, usually people of color, which will increase kind of the prevalence of environmental hazards. In my work, what I think about a lot are how this manifests in children or during pregnancy. So I'm a developmental biologist, and so I study fetal and then postnatal development, physical development. And the research shows that chemical and toxic exposures during pregnancy and in early life can have some pretty devastating consequences. So if a pregnant person lives even within miles of an inactive fracking site, their child is likely to be born with a congenital heart defect. There's been a lot of childhood exposure to lead in the water, examples being Flint in New Jersey, even in New York City. And that can cause huge issues when it comes to brain development, especially early in life. So I'd just like to say that our well-being is linked to that of the planet, and we need our children to have a safe place to grow up. So we need to put the work in and invest in these communities. Otherwise, we'll never get better.
Thanks so much, Briana. And now to our last panelist, Harlan Pruden.
One, thank you so much. It's just an honor to be here and a part of this incredible conversation around the March for Science and looking at COVID at the same time. The one thing that I would like to take away, or I think is important to highlight as an Indigenous person, is that we've been here before. And I know that this has been kicking up a lot of stuff and a lot of personal reflection as I've been locked down in my little apartment for the last 4 weeks and working from home. One only has to look at the founding of the various nation states that have now overlapped and are all on Indigenous lands of the Americas, or what we would just refer to as Turtle Island. And where there was an estimated 90% of Indigenous people had died either intentionally or unintentionally being exposed to new pathogens, or actually being intentionally exposed to pathogens. Like we all know about the stories about the smallpox blankets that were gifted to Native folks. And it is within that I am here as a testament after of this long lineage of 529 years of a survivor, and also still living here from colonization, that we will get through this. And so there is always this place of hope. The other thing that I would like to really quickly talk about is that within the midst of this pandemic that we are going through right now, is that it's really uncomfortable for me that we're someone who has some health challenges, who are also that I'm Indigenous, and also that I am Two-Spirit and gay identified, that I would be, and members of my community would be defined as being vulnerable, where I don't look at myself as vulnerable, nor do I think of myself as being vulnerable. Quite the contrary, that I look at myself as someone who is resisting and surviving, or what I would combine those two as the survivance, right? And so it is the positionality of that vulnerable and vulnerability is that it places and unduly places the responsibility on me as the individual, where I think what we should start be looking at, and Briana, I think, so beautifully articulated this, is that we have to start looking at the systems of heteropatriarchy, systems of male supremacy, white supremacy. And we have to start focusing on those systems that make me more susceptible and members of my community more susceptible. And I'm also talking about my female assigned and my women identified sisters that make them vulnerable. And then the other thing that, and I would like to end with a message of hope, that there's another hope that COVID shows that we can respond quickly and we can adapt so quickly. And I know that for the last 4 weeks that I've been working from home, I haven't been driving, I haven't been taking public transportation, and I'm also walking more kindly and gently at home, our great mother, the earth. And I think that there is ways in which when we look at climate and climate justice, it seems to be so overwhelming. But at the same time, within a matter of a month, we have radically changed how we are living, how we are using our resources, and how we are finding new ways to bridge this very conference of March for Science that's happening virtually. So I also think that there is like these shining spots. And so within that, I share a Buddhist temple that a Buddhist saying, one that I also take to heart, is where there is the darkest shadow can only dwell in the brightest light. And we must look at both of the opportunities, but also the incredible sadness and pain that we are currently weathering. Thank you.
Thank you so much, Harlan. And I just want to say thank you again to all of our panelists. We're seeing so much now more than ever the importance of really understanding and embracing the intersectionality between many different crises that we have going on, and understanding that we need to analyze these things together so we understand. So thanks again, and now I will hand it off to our next speaker, Lauren Anderson.